Okay, so we are ready to get started. Hello, everyone. My name is Abby Currier, and I'm the Community Engagement and Events Coordinator here at the History Center of Olmsted County. I'm so excited to see everyone on here tonight, and I look forward to learning more this evening about Norwegian immigration and healthcare. Here at the History Center of Olmsted County, we invite people to gather, socially distant of course, and explore and examine our past as we educate ourselves about the stories of Olmsted County and southeastern Minnesota. We're so excited that you have decided to join us tonight as we take a look at one of these stories. Tonight, we're going to have a presentation from Dr. Anne Legreid on health and benevolence, examples from Norwegian America, looking at the history of Norwegian immigration and the healthcare challenges that they faced. After her presentation, we will have about 15 minutes for questions from the audience. During the presentation, feel free to drop any questions that you may have in the chat, and we will try to answer as many of them as we can. But before we get started, I just want to go over a couple of logistical things. For tonight, we are going to keep all of you muted so that we can listen to our speaker. Like I said, if you have any questions, drop them in the chat, and we will do our best to answer as many of them as we can. We may also put some links in the chat throughout the night, so make sure you keep an eye on it. Anything that we do put in there, we will be sure to send to you tomorrow morning, along with a quick survey about tonight's program. It will take less than 2 minutes to fill out, and we really appreciate your feedback. We also recommend watching this in presenter view, but if you want to see everyone participating Brady Bunch style, you can do that by clicking on presentation view in the upper right-hand corner of your screen. If you are joining us from an iPad, you may have to swipe a couple of times to change the view. We are recording tonight's program, so please keep that in mind. We're so excited about tonight's talk and hope that you will continue to join us for some of our future events, where we will talk about everything from women in World War I to wax models at the Mayo Clinic to the fight for same-sex marriage and everything in between. These talks are one of the many great benefits to having a membership to the History Center of Olmsted County. We certainly hope that you will continue to join us for these talks, and we also hope that you will consider getting a membership to experience even more benefits. Tonight, we are joined by Dr. Anne Legreid, who is a professor of geography at Shepherd University in Shepherdstown, West Virginia, where she has also served as an academic dean for the past decade. She earned her PhD and MS in historical geography from the University of Wisconsin-Madison. Her specialties are European and North American geography, cultural and historical geography, and migration studies. Dr. Legreid has been a Fulbright Scholar to Norway and the recipient of the Crown Princess Martha Award from the American Scandinavian Foundation. She is a native of rural western Wisconsin and has ancestral roots in Hardanger and Hedmark, Norway. Dr. Legreid?
Thank you very much, Abby. It's a pleasure to be here this evening. I feel like I've come home in a sense. As you indicated, I grew up in the Midwest and I'm very familiar with Rochester, the Mayo Clinic, and so forth. So this is kind of exciting for me too. I will share the screen now if that's okay. Hey, is that visible to everyone?
Yep, we can see that.
Okay, very good. I'm going to begin with a very brief overview of Norwegian immigration into the United States. Then I'll consider some of the health challenges that were faced by Norwegian immigrants. And I'll finish up with an example of benevolence, particularly a children's home in Iowa. On this slide, you can see a stamp that was issued in Norway back in 1975, the 150th anniversary of Norwegian immigration into the United States. And that's what it says, Utvandringen til Amerika, the immigration to America. Between 1825 and 1925, more than 800,000 Norwegians migrated to North America. That was about 1/3 of Norway's population. Only Ireland sent a larger proportion of its population overseas. Norwegians were among what we call the old migration, people that came from Northern and Western European countries from about the 1820s to the mid 1880s. And you can see the new migration, people primarily from Southern and Eastern Europe, that would have been the mid 1880s to the early 1920s. Norwegians were generally welcomed as good workers and citizens. After all, they were white, they were Protestant, and they were mostly literate. And here you can see a Norwegian family that has arrived at Ellis Island. This shows immigration of Norwegians into the United States from the 1870s forward. And you can see that two of those bars are really high. That's the 1880s and the 1900 to 1909, when there was a great demand for industrial workers in the United States. There's been very little immigration from Norway to the United States since the 1920s. There were a couple of spurts after the Second World War, refugees, but relatively little since the 20s. There are lots of Norwegians living in the United States today, but they retain their Norwegian citizenship. Most Norwegians came into the United States through New York Harbor. If they came in the early period, they likely would have come through Castle Garden, which functioned between 1820 and 1892. And if they came in a later period, they probably came through Ellis Island, which is pictured there on the right-hand side. And that opened in 1892 and it functioned until 1954. Now, very early Norwegian migrants might have come through Quebec and through the Great Lakes area, and then arrived in Milwaukee and took the train for parts westward. And other Norwegians might have come through Boston, Philadelphia, New Orleans, or some other ports, but the vast majority came through Ellis Island. Most of the Norwegian immigrants settled in the upper Midwest. That's no surprise. This is a map from 1901 from the work of Martin Ulvestad, who has several volumes published on Norwegians in America. You can see the big blob up there, and then some outliers: Puget Sound, Washington, the Salt Lake Basin, and a spattering here and there. Brooklyn, New York was a big center. Texas, yeah, most states had some Norwegians, but the overwhelming share were in the upper Midwest. Today, about 4.6 million people claim Norwegian ancestry in the United States. That's about 1.5% of the US population. Minnesota leads. Minnesota has 868,361 that claim Norwegian ancestry as of the 2010 census. That's followed by Wisconsin, that has roughly half of that, California, Washington, North Dakota, Iowa, Illinois, Oregon, Texas, and Arizona. And we know that the Norwegians like to celebrate heritage. Here we see singers forming the Norwegian flag for the Norwegian centennial in June 1925. The first organized migration of Norwegians into the United States was 1824. They were called the sloop folk. They came on the sloop Restoration from Stavanger to New York. Initially, they settled in Kendall, New York, but then they made their way to Northern Illinois and Wisconsin. And you can see that 2025, we will be celebrating the 200th anniversary of Norwegian migration into the US. And there are discussions on both sides of the Atlantic right now planning various activities. The picture that you see up in the right-hand corner, those are the Stoughton dancers from Stoughton, Wisconsin. Young people that keep the heritage alive. If you haven't seen them perform, they are definitely worth a drive to Stoughton. They do tour occasionally, but if you want to see them on the Setnamai, go to Stoughton. I'm getting this message. Please move this. Yeah, okay. Can everyone see that? Yeah, okay.
Yes.
On most health indicators, Scandinavian Americans were among the healthiest immigrant groups coming to the United States. They came from countries that had established vaccine programs and physician districts in the homelands. They had what were called bygde doctors or regional doctors and press doctor, minister doctors. And of course, doctors' wives were often very skilled in midwifery and nursing. They had public officials that were promoting health services throughout the Scandinavian countries. They had compulsory public education from a very early time. It became compulsory in Norway way back in 1739. They had traditions of child and poor rotation, where they moved the child and the poor household to household, farm to farm. The term for that, trygdekassa. They had well-established traditions of folk medicine and midwifery, and they had traditions of neighborhood assistance. In Norway, it's called grannalag, where neighbors would come together for various tasks. And if it was a much larger group, several neighborhoods, they called it bedlag or dugnad. And once in the United States, Scandinavians cooperated in church and community-sponsored health and welfare programs. There was a lot of activity on the grassroots level. Scandinavian birthing and child rearing practices resulted in some of the lowest infant mortality rates among all immigrant groups. They used midwives, breastfeeding, good nutrition, and had reasonably good sanitation. By contrast, the Irish and Poles had scandalously high rates of infant mortality. Norwegian immigrants flowed into the United States on the heels of the Civil War, and thus they became active participants in the public health campaigns that emanated from that war. Norwegians involved themselves at many levels as local sanitary officers, educators, churchmen, concerned citizens, and all varieties of healthcare personnel. But they also fell victim to superstition, stubbornness, quackery, and age-old practices. Norwegians were known to bathe and change into clean clothes only 4 times a year, as an example. That would be in the early spring, midsummer, after the fall harvest, and at Christmas time. Christmas cleaning of the house and even the farmstead was essential and done vigorously because they believed it would protect the human beings from the huldra folk, the spirits that dwelt in the forest. Cleaning, of course, also gave them a sense of renewal. Germ theory did not gain broad acceptance until the early years of the 20th century. Thus, Norwegian immigrants were generally unaware of germs and ignorant of prevention. People perish for lack of knowledge, wrote the health officer at Trimble, Wisconsin in the 1880s. In 1880, the Wisconsin Board of Health reported the 5 most prevalent contagious diseases in the state: diphtheria, typhoid fever, whooping cough, measles, and scarlet fever. Diphtheria was considered the scourge of the state, arriving in periodic frightening waves. Yet it was tuberculosis, the slow, lingering disease, that took the most lives. Tuberculosis was strikingly high among the Norwegians in Wisconsin, particularly among the women, who were apt to spend long hours indoors in smoky, ill-ventilated kitchens, while the men spent longer hours outdoors in fresh air. A disease vector could operate in mysterious ways. Health officials in La Crosse noted the dangers of being a port city. Our cases of cholera were undoubtedly developed from communication with Davenport and St. Louis, they wrote. Some claim that diseases could be unpacked from immigrant baggage. In 1904, a threshing crew was blamed for the spread of smallpox farm to farm in La Crosse County. The Wisconsin State Board of Health, which was organized in 1876, mirrored a nationwide effort to educate the American public on health issues. The law required the organization of a board in every town, village, and city of the state. These boards had broad powers for engaging in community cleanup, conducting sanitary investigations, and compiling vital statistics. One La Crosse report in 1881 stated, "The board meets daily during the late spring and early summer until the village has been thoroughly inspected, manure piles have been removed, privies cleaned and disinfected, stagnant pools drained, and all sources of filth and disease removed." Milk was a leading vector in the spread of contagious diseases, and the Clean Milk campaign became a central component in the larger public health campaign. Some milk was adulterated with chalk, or it was watered down, made unwholesome by filthy stables, taken from diseased cows, or dipped from tubs tended by street vendors. Helga Gunderson, who's pictured there, wife of Dr. Adolf Gunderson, in La Crosse, dedicated much of her time and energy to the campaign to educate the public on the dangers of contaminated milk and to develop regulations on the production and sale of milk in La Crosse. She cooked the milk she served her children. Barnyard manure piles contaminated family drinking water. The sick and the healthy slept in the same bed and ate from the same utensils. There were no laws to exclude contagious youngsters from the district schools. Many immigrants were fatalistic in their thinking, convinced that disease and death were inevitable, inescapable as the will of God. Many feared getting too attached to their children lest they die, for the weak and diseased the Lord saw fit to take away. Some objected to quarantine as infringements on personal liberty. Norwegians generally did not object to vaccination, for smallpox vaccination was already an accepted practice in the parishes of their homeland. In 1864, immigrant Gro Svensson wrote to her family back in Norway, "Is it possible to send the smallpox vaccine in a letter?" A month later, Gro received 3 bottles of the vaccine from her father. Public health officials chastised ministers and teachers for failing to enforce quarantines. Public funerals were an ongoing concern. One reporter wrote in 1881, "These services are attended very largely by children, held either in the church or the school building itself, who in some cases are selected to act as pallbearers and to sing in the choir. It is not unusual, moreover, for the coffin or casket to be opened during the funeral ceremonies, no disinfectants being used, and all present being invited to view the body." Public health boards asked priests and ministers to instruct in health matters from the pulpits, to wage the battles against superstitions, ignorance, magic, and quackery. Norway's Black Book was a mixed bag of folk remedies, prayers, and folk magic. Many believe that contagious disease came from the night air or electricity in the air. Some believe that tuberculosis was inherited since it often afflicted several members of the same family. Varicose veins could be cured by the kick of a cow. One Norwegian found himself cured of rheumatism after attending an Ole Bull concert. At the Koshkonong, Wisconsin settlement, some settlers refused medical treatment from Soren Hansen, a Norwegian physician, fearing their souls would be lost because he was an outspoken critic of Orthodox Lutheranism. Some medical practitioners believed that insanity, idiocy, and tuberculosis were the result of an overindulgence in alcohol and tobacco. Public health officials lamented the condition of schoolhouses, citing them as ill-maintained, dilapidated, and lacking in light and ventilation. One reporter described the schoolhouses at Waverly, Wisconsin as miserable log houses. Some of our country's schools are little better than pest houses, wrote another. Children cooped up in such rooms become apathetic, myopic, and frequently sick. These houses are designed for the slow murder of their occupants. Schoolhouses, when contaminated, were then fumigated by burning sulfur and then kept closed for 10 to 12 hours, usually followed by a painting or a whitewashing. Norwegian immigrants often feared and resented the Yankee doctors, questioned their methods, and suspected their treatments as wrought by the devil. In the 19th century, diagnosis and therapy were based largely on the condition of the tongue and the pulse. Bleeding, vomiting, and purging were three of the most common therapies. One Yankee physician believed that tobacco smoke was a sterilizing agent, so he smoked a cigar through each of his surgical procedures. Hospitals were often viewed as last resorts, little better than pest houses. Immigrant fears were well-founded. Norwegian immigrants tended to prefer doctors from Norway and traditions of folk medicine. When those were not available, they may have suffered in silence and even died. Elise Vadenskjold, an immigrant to the Texas prairies, complained about American doctors and healthcare standards. She wrote, "How many times have I wished that we had as good doctors here as we had back in Norway?" Norwegian immigrant women tended to favor Norwegian midwives over American doctors. Midwives were familiar and female, spoke the same language, and could assist in the home following delivery. Norwegian immigrant Dr. Adolf Gunderson recognized a desperate need to serve his fellow Norwegians, often taking eggs and milk in payment for his services. He established the first medical group practice in America. Today, of course, it's known as Gunderson Health System of La Crosse. Dr. Gunderson was known for his insistence on hygienic methods, often encountering resistance from others in the medical community, and he lamented the ignorance that lay behind the spread of contagious diseases. Forms of sectarian medicine also emerged, as, for example, hydropathy, water cures, and eclectic medicine, the use of botanical preparations. Eclectic medicine caught on with Norwegian immigrants, especially in those communities where botanical approaches were an old world tradition. One option, garlic rubbed on the spine, would cure whooping cough. Norwegian immigrants did not escape the ravages of communicable disease. In fact, some of the early Norwegian settlements were nearly wiped out by disease. And of course, that included the Spanish flu of 1918. Here you can see the death rate for various communicable diseases in Wisconsin as of 1918. Clearly, the Spanish flu stands out. This shows deaths due to the Spanish flu in Dane County, Wisconsin, which includes Madison. And you can see that the rate was really high for people in their prime, 20 to 40, people that had the most robust immune systems. Often called the purple flu, people literally drowned in their body fluids. Norwegians did not appear to fare any better than non-Norwegians, at least not in Dane County. Norwegian Americans reacted in innumerable ways to disease and death through benevolent organizations, deaconess hospitals, clinics, home finding societies, day nurseries, and orphanages. My focus tonight is on the work of church personnel in an orphanage in Beloit, Iowa, established in 1890 by the United Norwegian Lutheran Church in America. The child-saving movement began in Europe in the 19th century under the auspices of a few middle-class philanthropists. A primary motive was social defense, and that by saving young people from the horrid influences of pathology and destitution, they were saving them from the gallows and jails and thus preserving social order. The prevailing view, of course, is that poor people were to blame for their poverty. Poor people needed help in raising their children, and the best way to do that was to remove them from their homes. The Beloit orphanage fell under the category of protecting asylum in the sense that it provided shelter from family hardships. And it was integrating in the sense that the administrators encouraged ongoing interaction between children and their families and communities. The first orphan asylums in the United States emerged in the early years of the 19th century, and that was largely in response to cholera outbreaks. Among Norwegian Americans, orphanages were established mostly by church groups from the 1880s forward. So that would include Beloit, the Martin Luther home in Stoughton, the Hami home in Wittenberg. There were lots of them. Their mission was to provide food and shelter, a semblance of home, secular education, and moral and religious training. The preservation of ethnic and religious identities was a very high priority. Financial support came from private donations, from congregations, the synod, resident fees, and profits from the farm. The farm was usually the largest provider. In the case of Beloit, income came from the sale of pigs and chickens, children's festivals, birthday boxes, Juletræfest, Christmas collections, and confirmation offerings. The orphanage was closely aligned with a parent congregation that provided family-like opportunities for the children throughout the year. Beloit's home provided both secular and religious education in English and Norwegian. They sponsored Sunday worship services where staff and residents worshiped together. They also had Sunday school classes, catechetical instruction, and morning and evening devotions. They published Messenger, a newsletter, which was a conduit to their support base of congregations and the synod itself. Children were engaged in both literary and manual training. Our ultimate goal, wrote the superintendent in 1919, is to give the child an experience which will develop in him character, efficiency, and self-reliance. One alumnus wrote about learning to make skis, to build and carve chairs, and to kill and butcher for the kitchens. Another noted, we had a big herd of purebred cattle, 52 milk cows. We kids did the chores, field work, and all. We took care of 24 horses, did all the farm work. The word orphan is often misinterpreted to mean a child who has lost both parents. The majority of children in these orphan asylums, however, had one or even two living parents. Children were placed in the home by parents, ministers, or agents of the state. And in many cases, the parents were both alive. Over the lifespan of the Beloit orphanage, the death of the mother was the major reason for taking in children, followed by death of the father, followed by financial difficulties. So the largest single group of children had at least one parent living. The reasons varied. Father in penitentiary, mother died. Father's a traveling man, mother skipped. Mother pregnant, father skipped. Mother feeble-minded. Mother has tuberculosis, the father's in a very difficult financial circumstance. And in some cases, a minister, perhaps seeing a case of abuse, would take that case in hand and bring the child to the home. In order to be admitted to the Beloit home, the child must be poor, of sound mind and decent habits, and in need of a home. And I should add also Lutheran. A child could only be admitted through a minister with proper application. There could be no evidence of contagious disease, and certificates of health were required. Non-Lutheran children were admitted from time to time, but only when room and means to provide for them were available. Children were expected to work as well as play. For example, the houseboys made beds, ironed, mended, and darned stockings. The barn boys helped with the chores, milking, separating the milk, and field work. At its peak in the 1920s, the Beloit home consisted of a central dormitory, an older girls' cottage, 2 boys' cottages, a schoolhouse, church, workshop, carpenter shop, a laundry, administration building, and 10 farm buildings. It was a total of 627 acres and 20 buildings. Children were divided into departments according to gender and age, each overseen by a governess. So here on this slide, you could see a summary of some of the characteristics of the Beloit orphanage. South Dakota was actually the largest contributor of children during the lifespan of this orphanage. It was mostly children 2 to 12. Occasionally, some were 16, 18 years old. At the age of 18, they would have been expected to go out into the work world. Children who could be adopted out were not housed at Beloit. They were sent to the home finding department of the church. And yes, they endured bouts of contagious disease, but death rate was relatively low. It was actually lower than for the general population. In the 54 years that the orphanage functioned, it had 21 deaths. So it was not a large number. And you can see in 1918, they had 128 children. They maxed out in 1926 at 177. There you see Beloit from Google. Beloit is over near the Big Sioux River. That's South Dakota across the river, not too far from Canton, not too far from Sioux Falls. If you see that cluster of white buildings, those are not the orphanage buildings today. The orphanage buildings have been torn down, but the orphanage included most of that area north of Beloit. So 627 acres at its largest and 20 buildings. You see a monument there honoring the 21 children that died in the course of its history. About 1,000 children were housed there over 54 years. The length of stay varied by need from a few months to 18 or more years. The average age was 10. The child was not to remain at the orphan home any longer than necessary. The philosophy of the church was simple: the child belongs in the home. Children were permitted to leave the home upon resolution from the Board of Trustees. And here are a couple notes from the discharge register. Of age, went to work, went to his guardian. Father married again and now able to care for the children. By the late 19th century, government sponsorship of childcare was emerging across the country. The vast majority of orphan homes remained private concerns, community-based, and catered to the specific needs of certain ethnic and religious clientele. The White House Conference on Dependent Children in 1909 called for keeping families intact by supporting poor widows with pensions. Orphanages began to fall out of favor with child welfare reformers. The number of orphanages in the United States peaked in the 1920s at about 1,550. And yes, the Scandinavian Americans did have lots of them. Orphanage resources were always strained, and with the Great Depression, the writing was on the wall. Many of the orphanages closed. By the mid-1940s, public programs led in caring for America's destitute children, in particular aid to dependent children, and by that time also foster care was emerging. Caseloads were moved from orphanages into the care of state, county, or larger sectarian programs such as Lutheran social services. In the case of the Beloit home, the professions were incorporated: psychiatry and social work, and the home began to offer additional options for care and counseling. The Beloit home was relocated to Ames, also in Iowa, in 1948 to be nearer the specialized services available in Des Moines. The old buildings were beginning to crumble in Beloit, so they felt it was time for a change. Beloit was owned by the American Lutheran Church until merger with Lutheran Social Services of Iowa in 1982. Today, it is a multifaceted residential treatment center for troubled youth, and it's called Beloit of Ames. Norwegians in America did not escape disease, dysfunction, and financial strains, but they did come armed with literacy, a general acceptance of vaccination, folk medicine, and a long-standing tradition of community cooperation in child and poor rotation. In that respect, they had an advantage over some immigrant groups. In their campaigns for improved public health and personal hygiene, they certainly battled superstition and ignorance. Perhaps most importantly, Norwegian immigrants in America did not function in a vacuum. They crossed ethnic boundaries in the common cause of promoting public health and child welfare in their respective communities. Do you have questions?
It does look like we have some questions. If you don't mind, I'm going to end the PowerPoint. And then we'll put this one. One second. Sorry, I have to pull up the right screen here. All right, so our first question came in fairly early in the presentation. Was there something in particular that attracted the majority of Norwegians to the upper Midwest?
It had a lot to do with the poverty of the Norwegians and the opportunities that they saw in the upper Midwest in terms of either free homestead land or inexpensive land that they could still purchase from the railroads. Areas east of there were quite expensive. Land had been gobbled up, certainly in the Ohio River Valley, so the Scandinavians kept moving westward, and a lot of them did get the 160 acres of homestead land. The Homestead Act was passed in 1862, so the timing was good. Norwegians started coming into the Midwest in the late 1850s and up through the 1880s in large numbers, so yeah, the timing was good.
What were some of the things that drove the Norwegian immigrants to immigrate? Was there strife at home, or was it just the opportunity for more land?
They came very close to ecological collapse. If you've heard of Malthusian theory, Malthusian collapse, too many people given the resources that were available. Certainly in some of the interior parishes and West Coast parishes. And there were years when the herring simply disappeared. Some of the coastal communities were very dependent on fishing. And when the fishing banks sort of dried up, they were left hanging. So I would say extreme poverty. And Norway was a very poor country even as late as the 1960s. But in the late 1960s, oil was discovered in the North Sea, oil and gas. So today, Norway is one of the richest countries in the world. It also has an abundance of hydropower that it sells today. It sells hydropower throughout Northern Europe, so that's a major source of income. It's quite ironic that my ancestors left Inner Hardanger, Eidfjord Hardanger, one of the poorest areas of Norway, and today it's one of the richest
Yeah.
because it has a hydro plant there near Eidfjord.
It sounds like you missed out.
I missed out, yes.
So in reference to the children's homes, were children of different ethnicities and or religions welcomed at these homes? I know you touched on it a little bit, but I didn't know if you could expand.
The focus was very much Norwegian Lutheran.
Mhm.
It's hard for us to think in these terms today. We don't want to discriminate against people, but there was a lot of discrimination. Um, Certainly, if it was a compelling case and it was argued by the minister, then they would take in other ethnicities, other religions, but they were adamant that they had to have sufficient resources before they would take in non-Lutherans and non-Norwegians. Now, in the early period, it was like 100% Norwegian. By 1920, there were a couple of Danes, and I believe 3 or 4 of Swedish heritage, and 1 or 2 of German heritage.
But still mainly Nordic
Oh,
people.
yeah. Mm-hmm.
Were there any healthcare issues that were unique to the Norwegian community? Things that like they faced that maybe other immigrant groups didn't?
In terms of contagious disease, I don't think so, other than what I said about tuberculosis. But there are a number of genetic disorders that we associate with Northern Europe. Autoimmune disorders, skeletal misalignment, thyroid. Yeah.
Okay. I think we have a couple questions coming in. All right. Can you talk at all about Norway being under Denmark from 1536 to 1814 and part of Sweden until 1905? And did these situations lead to more poverty?
Yes, Norway was under the thumb of the Danes for hundreds of years, as you just noted, and then there was this rather strange arrangement from 1814 until 1905 in which they were under the thumb of the Swedes. And yes, the aristocracy was in Denmark and the aristocracy was in Sweden. The Norwegian royal family had died out in the Black Death, so they had no upper crust. They had a mercantile group, a small, upper class mercantile group, but it wasn't like Sweden and Denmark. There's a story that my great grandmother walked from Norway to Stockholm and had an audience with the king to complain about the extreme poverty in Norway. I don't know if any improvements came from that little expedition, but it's a good story.
Mm-hmm. Yeah, that certainly sounds like a very long walk.
Definitely. 8-10 hours by train.
Yeah, I much prefer email. How did the healthcare needs of the Norwegian community change over the years? And are they still a distinct group in regards to healthcare needs? Or have they been more or less assimilated?
Well, I would say that overall the Norwegians did better than the American population as a whole. They certainly did better than lots of immigrant groups in terms of overall health and well-being. As I indicated, it was more of the genetic disorders that have plagued Norwegians.
Okay.
It's a very, very old gene pool. It's one of the oldest, if not the oldest gene pool in the world. And when you have a situation like that, you tend to have certain genetic disorders that are transferred.
Now, I know you mentioned in your presentation that the children at the Beloit home, if they were to be adopted out, then they wouldn't be in the home. So how did most of the children leave? if the average age was about 12?
Well, if the situation in the family changed,
Mhm.
so if the father remarried and then could handle all of the children, what often happened is that a family would place one or two children in the orphanage and have two, three of them at home. They just couldn't support all of them through hard times, especially if one of the parents passed away. Um, they needed help.
So then the hope was, though, that once the hard times were over, the parents would come back and collect their
Right.
children.
Uh-huh. I think it's interesting that the greatest numbers in the Beloit home were from 1918 to 1927.
Mhm.
So, you had the Spanish flu and you had the First World War, and I guess some of the after effects of that, how that impacted families.
Mhm.
But the 20s themselves were quite prosperous. You would have expected large numbers in the 30s, but there were not larger numbers in the 30s.
Interesting. Well, you said I would have expected more during the Depression.
Mhm.
Let's see. Did the homes provide for children with disabilities?
Um, I can't say that I have seen anything on that. The tradition was that disabled children went to special asylums,
Mhm.
usually run by the county. Yeah, in all my reading on orphanages, I can't recall anything on physical disabilities.
Okay. Um, so was there a particular skill set that they brought with them, the Norwegian immigrants, that made living in the Midwest easier? Like, were they known for a specific trade or something?
Norwegians were very good in the building trades and in lumbering. These were traditions from certainly eastern Norway and neighboring Sweden, where there was a lot of woodland. They were small time farmers. My family came from the west of Norway, where it was very small farms, just a few acres, and they had sheep and goats, maybe one cow, maybe a pig or two. So that's how they started out when they came to the Midwest, very small.
I was wondering if you could talk some more about the home remedies and maybe some of the more crazier ideas that were used for healthcare that could have worked or may not have worked at all.
Well, I'm not an expert on that, but I have a book I'd like to refer you to.
I love getting referred to a book.
Yes, it's titled Remedies and Rituals, Folk Medicine in Norway and the New Land. It's written by one of my friends, Kathleen Stoker. She's recently retired from Luther College down in Dakota.
Mhm.
You might want to invite her to do a presentation on folk medicine because she is the expert. She has translated these black books from different locations around Norway and written a very nice volume on this.
All right, I will be sure to include that book in our links for tomorrow.
Mm-hmm.
Can you touch a little bit more on the black books that you just mentioned? What those were?
Well, these were books that were passed through the generations that held a variety of things. Um, I don't know what you would equate it to, sort of a medicine book, sort of a book of magic, a book of pagan practices, a book of Christian prayers, really a hodgepodge of things.
It sounds a lot like Wikipedia sometimes.
Mm-hmm.
And just everything you could need to know is in this book.
Right, right. Yeah, and
Uh,
I think it's kind of unique that it was written down because in many cultures it would simply be an oral tradition.
Mhm.
passed generation to generation. But in Scandinavia, they wrote these down in books and passed it on that way.
Yeah. One of our guests tonight, LaDonna McGowan, sorry if I mispronounced that, actually works at Luther College.
Oh, okay.
So she mentioned that in the chat.
Mhm.
We have another question. Are families still connected to their relatives in Norway? Like, is there that strong tie?
Oh, most definitely. Yeah, I think Norwegians in America have remained very ethnically conscious.
Mhm.
And a lot of Norwegian Americans have some ties to Norway. Distant relatives, in my case, I have distant relatives that have become very close friends. So we Zoom one another and we travel back and forth when we can. Yeah. I,
And
I
I know,
should I should mention that the Norwegian American Historical Association, which is based up at St. Olaf College, is the oldest and largest ethnic organization in the United States. The Norwegians have remained more ethnically conscious than, say, the Danes and perhaps even the Swedes. And maybe that's because Norwegians were more rural than the Danes and the Swedes.
Mhm. And you said that the 200th anniversary of immigration from Norway is coming up.
Yes, organized immigration from Norway, 1825, 2025.
What do you mean by organized immigration?
Well, there were some Norwegians that came early on into New Amsterdam, for example, and other areas on the East Coast. But the first organized group was 1825. They sailed from Stavanger, Norway, in the southwest to New York, and they were led by Kling Pearson. And he eventually brought them to the Midwest, and then he somehow ended up in Texas and is buried down in Texas in one of the Norwegian American settlements.
I just want to see if we have any other questions. Was it common for families to immigrate together, or would they send like one or two representatives and slowly move families over?
Chain migration was very common. So maybe the dad went first, and then the mother and the children. Or maybe a single young man went, and then his siblings came one by one. That was the case with my family, that the siblings came one by one, not the entire uh, nuclear family.
And then I presume that they would typically settle near each other.
Oh, yes, because of dialect.
Mhm.
Yeah. Familiarity, wanting to be near people that you knew, and then the dialect.
Do the dialects vary widely in Norway?
Oh, yes, there's probably well over 100 dialects in the country. Yeah. My mother's family comes from the eastern side of Norway near Sweden. My father's side from the west side of Norway, and my mom and dad could not communicate with one another in Norwegian because the dialects were so different.
Huh. I wouldn't think it would have that wide of a variety.
Mm-hmm.
Do you speak Norwegian?
I try to.
Okay.
Yeah. I studied Standard Norwegian,
Mhm.
which is closest to Danish, so I can read Danish. But if I go to Western Norway in the dialect area, it's very difficult.
Mhm.
My father's dialect, yeah.
Great. Did any of the early immigrants ever go back to Norway?
Oh, lots of them went back. Some of them were disillusioned, some of them were homesick. Um, Life in America was hard. There were many of them that said it was much harder here than back in Norway. They had to work so hard here. Yeah, breaking the ground, cutting trees, all that sort of thing.
So they were able to afford passage both across the Atlantic and then back.
Right, yeah. Some of them went back and stayed, and others just went back to visit. Some people went back many times. Helga Gunderson and Adolf, the doctor family in La Crosse, they went back to Norway every year. He immigrated here in 1891, and he was married shortly thereafter, I believe, and they went back every year. She wanted to stay in Norway, and he, of course, wanted to advance his practice here in the US.
So was it common for people with like a professional trade or skill, like the doctor, to immigrate? Because I would think they'd be well situated in Norway.
Thank you.
He thought there were too many barriers to practicing medicine in Norway, too much bureaucracy. That's why he wanted to stay here. He found he had more freedom. And a lot of Norwegians were really fed up with the state church of Norway. It was so strict, it was so conservative and unwavering. They wanted more freedom, freedom of thought and freedom of religious practice.
All right. Well, it looks like that's it for our questions. So I think we're going to wrap up maybe a little bit early tonight. But I do want to say thank you so much to our audience for asking all of these really great questions, and to our presenter for sharing her time and expertise with us tonight. We hope that you enjoyed tonight's program and that you continue to join us in the future as we talk about everything from Minnesota women in World War II to voting rights in Minnesota and so much more. Check out our website at olmstedhistory.com to keep up to date on all of our events and programs. If you enjoyed tonight's program, please consider making a donation to help us continue to offer this and other great programs, or consider becoming a member. A History Center of Olmsted County membership offers a wide variety of benefits, including access to free and reduced cost events like this. Thank you so much to everyone who joined us tonight, and we look forward to seeing all of you at our next event. Good night.
Thank you for all the great questions and for hosting this.
Yes, thank you.